Hello, welcome back to the channel. Today we have a story that is both inspiring and controversial. 45 Zimbabwean nurses have launched a clinic in South Africa that is dedicated exclusively to treating undocumented foreign nationals. Please watch until the end so you can see the sources and verify the news for yourself. Before we dive into the details, make sure to subscribe to the channel so you stay updated with news that affects our communities and our country. The clinic, which has been set up in a busy urban area, is aimed at providing healthcare to foreign nationals who do not have legal documentation. According to the nurses, their motivation is simple: they refuse to watch people die because they lack the correct papers. They have stated that the initiative is not intended to compete with public hospitals or private clinics, but rather to fill a humanitarian gap for vulnerable individuals who might otherwise avoid seeking treatment. Community reactions have been mixed. Some locals and healthcare advocates have praised the nurses for their courage and dedication, emphasizing that access to healthcare is a basic human right, regardless of immigration status. Others, however, have expressed concern about the legality and sustainability of a clinic serving only undocumented foreign nationals. Critics argue that such a move could complicate an already stretched healthcare system, potentially diverting resources and attention from citizens in need. South Africa's healthcare system is under considerable strain, with public hospitals facing staff shortages, long waiting times, and limited resources. Some people worry that clinics serving only undocumented foreigners might create additional pressure on the broader system, while others feel that this approach is necessary to ensure that vulnerable populations do not suffer in silence. The nurses have explained that their clinic operates transparently and with proper medical standards. They are prepared to cooperate with authorities to ensure compliance with regulations, and they stress that the clinic is a safe space where undocumented patients can receive care without fear of harassment or deportation. Many undocumented individuals avoid public hospitals due to these fears, making it difficult for them to access essential treatment. Legal experts have commented on the initiative, noting that while providing medical care is commendable, operating a clinic exclusively for undocumented foreign nationals could raise legal questions. Authorities have yet to issue an official statement, but the clinic is likely to attract attention from regulators and policymakers, who will want to ensure that health standards are maintained and that laws are not being violated. The services offered at the clinic reportedly include treatment for chronic illnesses, maternal and child health care, immunizations, and basic emergency care. By focusing on primary health care and prevention, the nurses hope to reduce the number of emergencies reaching overstretched public hospitals, which could help alleviate some of the pressure on the system. Social media reactions have also been divided. Many users have applauded the nurses' commitment to saving lives, emphasizing that human dignity and survival should come before paperwork. Others have expressed concern that such clinics could encourage more undocumented migration or undermine existing healthcare regulations. The debate touches on broader issues of immigration, resource allocation, and the balance between compassion and law. Funding for the clinic comes largely from the nurses themselves and from community donations. This demonstrates their commitment to the cause and highlights the lengths to which healthcare professionals are willing to go to save lives. They maintain that the guiding principle is that no one should die simply because they are undocumented, and they are determined to uphold that principle. For a touch of light-heartedness after all the seriousness, you could say that running a clinic for undocumented foreigners is like hosting a surprise party where everyone forgot to RSVP. You are there to help, but there will always be a few unexpected complications. Nevertheless, the nurses appear undeterred and fully focused on their mission. This initiative shines a spotlight on the ongoing challenges South Africa faces with immigration, healthcare, and the need for humanitarian solutions. It raises important questions about how the country can balance compassion with regulatory frameworks and ensure that both citizens and non-citizens can receive care without compromising the law. Make sure to subscribe to the channel so you do not miss stories like this, which highlight both the challenges and the inspiring efforts taking place in our communities. Sometimes doing the right thing requires courage, dedication, and a willingness to take risks for the greater good. All images used are for illustration purposes only. News sources: News 24, Times Live, Southern Live, Daily Maverick.